So today we will be learning about the classification of the antihypertensive drugs. Antihypertensive drugs or hypotensive drugs. Please do not get confused. Both are same. Hypotensive, that causes the hypotension in increase the blood pressure case, or antihypertensive, that means against the hypertension. So both these two words terms are same. And this question is very frequently asked in the university examination and some other internal examinations also. And from these classifications, some short notes on some drugs will also be asked, as well as some important MCQs are also in this classification. I will be showing all that. So hope you go through the detailed lectures. Antihypertensive drugs. Antihypertensive drugs, or you also call it as hypotensive drugs. Classification. There are five major categories of these drugs, and some subcategories will also be there. I will be showing all those. At first, remember diuretics. Diuretics, and in this diuretics there are three subcategories. One is thiazides. Thiazides. Remember the examples. Remember at mnemonics, thief, where T for thiazides and S will stand for hydrochlorothiazide. This H will stand for H hydrochlorothiazide, and I indapamide. And H, forget the hydro for a brief period here, hydroflumethiazide. Remember this F, H and I, and T will stand for thiazides. Remember at thief. And there are some other examples also. I will be showing all examples in diuretics separate lectures that you will be studying in second year, like gipamide, and some more examples are also there. And among this, also this hydrochlorothiazide and hydroflumethiazide, its mechanism of action will be, it blocks the sodium potassium 2 chloride channels at a thick ascending limb loop of Henle. And this indapamide, gipamide and chlorthalidone. Here also I will prefer to write one more example, chlorthalidone. chlorothiazide, these three drugs will acting on the uh, early distal tubules and block sodium chloride channels. So why I wrote in sequence, you can understand. But at least remember, in any category, at least remember 2 or 3 drugs, or even you don't know that much also, at least remember 1 drugs, because something is better than nothing. So hope you understand the theme. Next will be aldosterone antagonist. Aldosterone antagonist, or you, you can also call them as potassium sparing diuretics. Why I wrote this potassium sparing? Because in MCQs you will ask that which of the following is the example of potassium sparing diuretics. So I also mention subtopic here. Examples will be uh, spironolactone, very important drug. Spironolactone, spironolactone, eplerenone, eplerenone, eplerenone. Remember at C, spironolactone, eplerenone, and A for aldosterone antagonists. Aldosterone antagonists. And there is one more category known as high ceiling diuretics. High ceiling diuretics. Examples will be furosemide, or furosemide. Whatever you write, both are correct. Furosemide, torasemide, bumetanide, ethacrynic acid, and organomercurials, and one more examples will be there. But that and this ethacrynic acid is only of historical value, not used currently, this ethacrynic acid. So remember this ice link as at H4 TB, tuberculosis. H4, don't call H4 as heroin. H4 TB, not heroin. This will stand for high ceiling, F furosemide, T torasemide, B bumetanide, and E ethacrynic acid. So these are diuretics. Now other examples, other category. Let's move on to the other category. 1, 2. I will be rubbing this for sake of convenience, writing above on the board. Number 2, renin system inhibitors, or blockers, whatever you want. Renin-angiotensin system inhibitors, Here also are three subcategories. Number one will be angiotensin converting inhibitors, AC inhibitors, AC inhibitors. Remember here on mnemonics, criminal, rapes, cute, female. Criminal rapes, cute, female. Please, not to be offended. This is only for mnemonics purpose. So, what will be the examples? Captopril, C for captopril, L for lisinopril, RA, ramipril, PE, perindopril, CU for cunapril, T for trandolapril, trandolapril. Again, here is F for fosinopril, and at last E will stand for enalapril. And this enalapril is very important drug. You might be asked to write short note on the enalapril or any of the categories. If you will be asked to write short note, remember for a particular class or category, you can write the use, adverse effect and contraindication nearly all for all the drugs for a category, for a particular category or class, and I will be explaining in detail about how to write drug formulary. So, and you may be asked in MCQ also, which of the following is the examples of AC inhibitors, like that. Next is angiotensin 81 receptor blockers or inhibitors. Examples will be here also. Remember short mnemonics: hat, I can tell about love. I can tell about love. Please remember, this love is not LOVE, love, of which you are very fond of. In that love, You might be betrayed, but remember this, love, you won't be betrayed. If you read the books or knowledge will not betray you. So examples will be Irby Sarton, Irby Sarton, Candy Sarton, Irby Sarton, Candy Sarton. Tell me, Sarton. A for remember angiotensin receptor blockers. L will stand for losartan, very important drugs of this category, losartan. And you might be asked to write short note on this losartan. O will stand for olmi, sartan, and at last L B for valsartan, valsartan. So remember these drugs. And there is one more category I will be writing here. And this is very important MCQ question. This will be your very important MCQ question, most frequently asked question. That is direct renin inhibitors. Renin, you know, this is the enzyme that catalyzes angiotensinogen, and AC forms angiotensin 1, and that angiotensin 1 will be converted to angiotensin 2 by this AC angiotensin converting enzymes, and that will produce angiotensin 2, and that angiotensin 2 will act in various ways to elevate the blood pressure and blood volume, and that will be that action of angiotensin uh, will be inhibited by all these drugs. That is, all these drugs will inhibit the renin angiotensin aldosterone axis. Direct renin inhibitor, very important drug, that is Aliskiren. You can pronounce whatever you like. So these are the renin angiotensin system inhibitors. Moving forward, on type 3. Type 3 will be sympathetic inhibitors. Sympathetic inhibitors, or you can call it as sympatholytics. Here are also subcategories. Number 1, very important drug categories that I explained in anti-adrenergic drugs in previous lecture. Beta adrenergic blockers. Beta adrenergic blockers. Examples you know well from previous lecture: propranolol, metoprolol, atenolol, acebutolol, bisoprolol, ismolol, lol. Remember mnemonics from that lecture at mabi, mabi or bima, whatever you whatever is comfortable for you. Remember. The next category will be I will write here number 2 alpha adrenergic blockers. Alpha adrenergic blockers. Alpha adrenergic blockers. Examples will be prazosin, terazosin, doxazosin, alfuzosin, tamsu, tamsulosin, phentolamine, and there are many other examples also. So remember these categories from previous lecture of anti-allergic drugs at date, palm, plant, date palm plant. In Gulf country, these plants are found, and you might have heard khajur, which is called khajur. Date palm here again D for doxazosin, A for alfuzosin, T terazosin, 1 T for tamsulosin, P for prazosin, and another P for phentolamine. Next category will be both alpha and beta blockers. These drugs will be blocking simultaneously alpha and beta receptors blockers. Examples will be carvedilol and labetalol. Remember this also at kala. And there is one more subcategory, that is central sympatholytics. Examples will be clonidine and alpha methyl dopa or methyl dopa. So these are the examples of sympathetic inhibitors or sympatholytics. Sympatholytics. Now type 4 will be you must have heard CCB. What does it mean? Calcium channel blockers. Here will also be subcategories. Number 1 phenyl alkyl amine. Examples will be verapamil. Number 2 benzothiazepine. Examples is diltiazem. And from this, why I am mentioning even subcategories, because from this from these categories, the one very important MCQ and Viva question is that among verapamil and diltiazem, which is more cardioselective? So your answer will be verapamil, because this verapamil is more cardioselective. And other categories will be number 3, dihydropyridines. Dihydropyridines. Here are many examples. Remember at enfa like this enfa beni lali C. Enfa beni lali C. National Football Association. Beni is a very beautiful place which lies in Magdi district of Nepal, and Lali C. So full form will be your enfa nifedipine F for felodipine A for amlodipine. This amlodipine is very important. You might be asked to write short note on this amlodipine. This B for benidipine, and I for nifedipine. I wrote first, and for nifedipine, nicardipine. Sorry, benidipine is this benidipine. This NI will stand for nicardipine. L for LA for lacidipine. Under LV will stand for lecardipine, and CI will stand for cilnidipine. Please cross match spelling, some of the spelling from your textbook. It is not a very big mistake or big problem. Nifedipine, yes. So remember enfa beni lali C. So these are calcium channel blockers. There is one more category. We call it as vasodilators. Vasodilators, here also will be subcategories. Number 1, arteriolar dilator. Arteriolar dilator example will be minoxidil and hydralazine. Remember at HM, hotel management. And one more category, and this will be very important MCQ. Both arteriolar and vasodilator, that is this drug will dilate both arterioles and venules and reduce the blood pressure. Examples is sodium nitroprusside. Sodium nitroprusside. This is again very important MCQ and Viva question. And remember the mnemonics for these topics also at Dr. Dr. Sam Dr. Sam uh, Kumar Dr. Sam Kumar Bhatta Dr. Sam Kumar Bhatta or Bhattarai, whatever you like. Dr. Sam Kumar Bhatta. D for diuretics, R for angiotensin system inhibitors or blockers, as for sympatholytics or sympathetic inhibitors, C for calcium channel blocker, and B will stand for vasodilators. Hope you enjoyed the lecture. Thank you so much for watching.